Hvovi presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. Unfolding Mental Illness by Hvovi, Family's Voice on Mental Illness, which is also the regional chapter of Face Me India, founded by Dr. Nirmala Srinivasan, is back with its podcast. Through these podcasts, we aim to provide tools, insights from experts, inspirational stories, which we believe that will help us to give a better understanding of the mental health ecosystem. I am Saraswati Suresh, the founder of Hvovi, and my host for today. And my co-host is Dr. Sachin Ganorkar, the director of Hvovi. Today's episode, our topic is understanding psychotherapy. And we hope to dwell and explore the world of psychotherapy and shed light into the transformative power of therapeutic practices. And our esteemed guest today is someone who I have great respect to and I admire her for her work that she is doing, Dr. Hvovi Bhagwagar.
Hi, Saraswati.
Hi, thank
Hi,
you
Dr.
so much for
Sachin.
coming on this show. To introduce Dr. Hvovi, she is a psychologist and a psychotherapist and has an experience of more than 24 years in this field of clinical psychology and traumatic stress. She holds her master's degree from SNDT in clinical psychology from SNDT Mumbai and a PhD in public sciences from Tata Institute of Social Sciences. She's also an international affiliate from the International American Psychological Association and an associate member of the Indian Clinical Psychology Association, and a volunteer for the International Studies of Trauma and Dissociation. And she's also committed to to advancing the field of trauma and dissociation studies in India. Since 2002, she has been in private practice, and her treatments are for mood disorders, anxiety disorders, trauma, including complex trauma, and adult survivors of abuse and neglect. She is also the founding board member of the NGO Mental Health Support Foundation, a very well-known NGO, which is working in the field for the individuals with mental illness and their family carers. She's written numerous articles in media outlets like the Times of India, the Hindustan Times, Midday, Mumbai Mirror, etc. Conducts a lot of webinars. And something I want to say is that I have attended some of her webinars, and she has a very unique style of presenting with a lot of analogies and narratives, which I really love them when she presents it. And she's also she's the recipient of 2 awards, the Young Environmentalist Foundation and the Times Healthcare in the Younger Achievers category. Welcome on board, Hvovi, and it's an honor and privilege to have you on board.
Thank you once again, Saraswati. And as I was telling you, I think it's an honor to be on this platform. As much education as we can spread about mental health, I think it's little in this field, in this world of stigma. And I also believe that the platform that you have for caregivers, the more you do, the more is needed. So thank you for having me here. The honor is all mine.
Thank you so much. So moving on to the first question, let's start with what is psychotherapy and how does it differ in the space of mental health treatment? I think we wanted to start from basics.
I think it's good to start from basics because these are some questions people fear to ask. And I try so many ways to educate my clients before they come in. One of the first questions I ask my clients is this your first visit to a therapist? Because if it is, then they often don't know what psychotherapy is about. And I'd spend that little more time to educate them about what is a process of therapy. Because as you know, there is a lot of misnomer, stigma, misconception about what is therapy. So therapy is a method of treating mental health issues or any adjustment issue in the person's life through conversations between a therapist and a client. Of course, conversations is one way to do it. There are many forms of psychotherapy. But the main aim is to help a person understand their thoughts, their feelings, and behaviors. So, medication usually will address the biological aspects of a mental health condition, and psychotherapy focuses on the psychological and emotional factors. We know that any mental health condition is not just biological. It does come with its emotional and psychological repercussions on the individual and the people around them. So, while medication helps with these symptoms, psychotherapy addresses the root cause and it helps the person with coping mechanisms. So, primarily, we work as a conjunction. The medication and therapy has to work together.
So
So, in short, in brief,
they
that's what
they
therapy
they
is
they,
about.
they complement each other.
They complement each other. Absolutely.
Yeah. So so when when I started as a family carer, there were so many names, a counselor, a psychologist, a psychotherapist, and of course there are also words like now life coaching, and and one doesn't understand who is what, whom should we go to, who's going to actually help us out, depending. I'm sure there's every person plays a certain part, but the understanding is lacking in amongst us. So if you
Absolutely. And again, a very relevant question. These are, in fact, the first question and the second question is something which I have put on my website because there's a complete section on my website on FAQs, the frequently
Okay.
asked questions related to therapy. I also make sure I give this out as a handout to my clients. Each and every one of my clients gets a handout on these various FAQs as well. Because I do believe that people are shy to ask these questions. They live with these misnomers, and I've had experiences where they will ask me some 10 sessions into therapy, when are you going to give me medication? Because they came in believing that I'm a psychiatrist. So I have learned the hard way that it is always important to educate at the get go. And I'm so happy that your podcast, if it is, being shared among a number of people on good channels, then there's some awareness that can spread through this talk. So let me start with who is a psychologist. So we have two broad groups. Firstly, we have psychologists and psychiatrists. Psychologists are those who will hold either a master's, an MPhil, or a doctoral degree in psychology, and they are trained in diagnosing and treating mental health issues related to the emotional aspect. They are not health professionals, so they will not be able to give you a prescription or medication. Their degrees will primarily be a master's in arts or a master's in science, an MA or an MSc degree. And they will often be the people that the psychiatrist will refer the patient to for psychological evaluation, psychological testing. And many psychologists also specialize in psychotherapy. So the broadest categories among psychologists are clinical psychologists and counseling psychologists. Clinical psychologists are those who work with assessments. You will find them mostly working in hospitals. Disability certification, your assessments such as doing, say, an IQ test or conducting a personality assessment or a neuropsychiatric battery. These are all done by a clinical psychologist. Clinical psychologists mostly work in conjunction with psychiatrists in psychiatry departments or in the general wards in hospitals, and they work with severe mental health issues. So that's one form of psychologist, a clinical psychologist. The second form is a counseling psychologist. Counseling psychologists often do not conduct disability certification or assessments. They really work with issues like, say, relationship problems or grief or stress. You also, I think it's also important to mention here that the word counselor itself in India does not have any kind of a licensing process. So anybody can call themselves a counselor. But ideally, a person who calls themselves a counselor should have a degree, a master's or an MSc to begin with in counseling psychology. That master's degree comes with a a certain number of hours of supervision and internship and field work, which is required for them in order to be able to practice in the field. So, broadly, psychologists are those who hold a master's degree. They can be either clinical or counseling psychologists. Clinical are those who work in hospitals, primarily with certification, assessments. Psychotherapy can also be done by them. Counseling psychologists primarily provide psychotherapy. However, there are other branches of psychology also in India, but I don't want to confuse the people who are hearing this podcast. But if you're seeking mental health help, then these are the two broad categories of psychologists that you will come across. Now, psychiatrists are they're medical doctors. Okay, they have an MD, not just an MBBS, but an MD, and they are uh, qualified to provide you with a prescription. So let's say you need a mood stabilizer or an antidepressant, you will have to go to a psychiatrist to be able to get that prescription. So that's the broad difference between a psychologist and a psychiatrist. Now, who are psychotherapists? Psychotherapist is a catch-all category. There is no degree in psychotherapy and there is no formal sort of certification in psychotherapy. So it's a broader term. A psychiatrist can also be a psychotherapist. A psychologist can also be a psychotherapist. So psychotherapists are those who are licensed to provide evidence-based psychotherapies.
Okay.
Now, just to make the confusion lesser, a psychologist finishes their master's degree and then they can decide to either work in hospitals with assessments and do psychotherapy alongside. If they want to do psychotherapy, then they also need to get trained in certain forms of psychotherapy that are evidence-based, that are certified, and that come with certain amount of research. For example, research-based psychotherapies or those which have been well researched are cognitive behavior therapy, EMDR, solution focused therapy. All of these are therapies that come with certain amount of practicum, practice, certification, and you get qualified in these psychotherapy degrees.
Okay.
Okay, so that's the broad kind of classification of these mental health professionals.
Okay. And life coaches are not at all, any kind of degrees with psychology, right?
Not necessarily.
Okay.
So life coaching again is pretty much a catch-all term.
Mm-hmm.
You can get trained in international life coaching organizations,
Yeah.
but one must be careful that they are not going for a mental health condition to a life coach.
Okay.
Much like you wouldn't go for cancer treatment to a life coach.
Correct. Okay.
You have to be careful that just because you believe that your depression is in your control, you
Mm-hmm.
just need to go to a life coach, get a few sessions where they make you feel better and go away. It doesn't work that way. People who are psychologists, they are trained to work with these mental health conditions. Those who are not trained to work with these mental health conditions can actually prolong the suffering, in fact, worsen the symptoms. And so we have to be careful that we are choosing to go to a life coach or we are choosing to go to somebody who is a non-mental health professional for issues that are not severe.
Correct.
If you're already on psychiatric medication, you need to be visiting somebody for your emotional issues and your mental health issues, those who have a valid degree and who have had enough supervision and enough experience working with this condition to know how to make out a treatment plan.
Okay. I got it.
Yeah.
Okay. So also, you mentioned in the evidence-based therapies like CBT, all these acronyms which one keeps hearing, DBT, RABT. I mean, I don't even know the full forms of all these, but these are names which I keep hearing. So how different are these? And how do we identify? I mean, is it the therapist who advises us which one we should choose, or how does one go about?
That's a very good question and it's very nuanced. There's no one single answer that I can give for this
Mm-hmm.
because, a lot of people read misleading information and believe that this particular therapy is only going to sort their problem out. The decision to use a type of psychotherapy often will be a combination of the presenting issues that the person comes to therapy with and the training of the therapist. Yeah. Abroad, it's a lot easier because there are therapists only trained in CBT or only trained in DBT. There is a lot more awareness what these different therapies do as well. Whereas in India, people are mostly just reading up things on website, on Google, or somewhere or the other, and believe that these therapies are like a magical cure. But let's break it down and simplify it for the audience. Let's say you have a depressive disorder, or you have a mood condition like a bipolar disorder. Uh, all these conditions have very strong mental, biological components associated with them. And most of the time, therapies that are cognitive in nature, that is, those who are working on our thinking patterns, faulty thinking patterns, on dysregulation of emotions, those therapies are very suitable for these biological conditions. For example, cognitive behavior therapy, dialectical behavior therapy are sometimes suited for these type of biological conditions. Now these therapies typically work on trying to get the person to think differently. They get them to find solutions to their daily life, change their behaviors, change their outlook or perspective, um, accept and change that certain things in life are going to remain the way they are. So these are CBT, DBT, REBT are all those forms of cognitive therapies. We also have an emerging whole new form of psychotherapy called trauma therapy, which are typically to work with people who have long-standing complex issues with, say, attachment or dysregulation, family disturbances or dysfunctionality, a lot of childhood abuse. They have grown up in homes there that have impaired their nervous system, and so they're not able to regulate themselves. They may have substance issues, addiction issues, they may have issues with relationships, and might come or present with problems like personality disorders, complex trauma, dissociation. For that entire group of human beings and individuals, we might have different types of therapies that would work with them. For example, you need more body-based approaches for those people, what we call as somatic psychotherapy. We might need EMDR that works with their trauma memories. So depending on the type of presentation that the person has, the type of psychotherapy is adapted accordingly. Now, the tricky thing here is that all therapists are not jack of all trades.
Correct.
Some therapists are trained in some forms of therapy, some therapists are trained in other forms of therapy. And a therapist should be ethically bound to tell their client that this is a form of therapy that they are not trained in, the type of presentation the client has. They are not trained to work with that. The problem is that in India, that ethics sometimes are not very strong, primarily because our licensing processes for psychotherapy and psychology are not very strong. As a result, because of unethical practices, many people get sort of stuck with practitioners who are not offering them the care and the kind of intervention they need. So abroad, what's typically done is that an intake is done. And then during that intake, by either a primary health physician or a psychologist or a psychiatrist, the person is told you need to visit a CBT therapist or a DBT therapist or a trauma therapist. That's not really, that kind of screening is not done here. It's left up to the patient to kind of, do their own Google checks or whatever and come to a conclusion on their own.
Okay.
So we need more awareness in this area. Broadly speaking, though, well-researched therapies or evidence-based therapies are definitely CBT, DBT, REBT, EMDR. These are all well-researched. Acceptance and commitment therapy, solution-focused therapy. All of these are well-researched forms of psychotherapy.
Okay. So, so here in India, the families have to find for themselves, or it's not the psychiatrist who helps them out?
Psychiatrists do, but psychiatrists also sometimes have limited knowledge on these areas because in India, a lot of psychiatrists don't practice psychotherapy. They have like a sort of a working knowledge, but not an in-depth knowledge. So you might not get the best intervention from a psychiatrist. Most psychiatrists favor cognitive behavior therapy or CBT. Often CBT is not the choice of therapy for a number of conditions. It's not like a like what do you say, cookie cutter kind of solution for everyone.
Mhm.
Different types of therapies may work with depending on the type of presentation the person.
Okay. So, like
Yeah.
you said, there is no screening process here. So, how do
Mm.
families then go about?
The saddest thing is that the only advice I can give to families is it might be a hit and miss.
Okay.
Primarily, like I said, there's no screening process. Our primary health centers in hospitals or in clinics are not yet equipped to be able to do a mental health screening to
Hmm.
tell the person that this is the form of psychotherapy.
Hmm.
And in most of the colleges and universities and in hospitals, everybody in the name of practicing psychotherapy is doing some hodgepodge CBT, which is not even proper CBT.
Okay.
CBT also you have to be trained in it, and you have to be trained in it with from the Beck Institute, which is the institute
Uh,
abroad that actually offers you the
so,
certification. And it's not some, I don't know what to call it, some fruit salad kind of thing that you are preparing on your own and serving to a client.
huh.
So it's a proper structured therapy with protocols and a way of working through it, which involves the person to go through the therapist or the person practicing to go through certain levels of workshops, certification, supervision to be able to practice this therapy.
Okay.
So oftentimes I feel that there is a lot of misleading that happens. Not everybody is aware what is CBT, and they're
Mhm.
just using that term but not doing the therapy correctly.
Okay. So,
So the
your website, does it have each one of them explaining? Okay.
Yes, I personally practice EMDR and CBT, and my website has a section in which I have tried to outline what each form of therapy means, along with links which guide them to the appropriate international association where they can get the correct data about the therapy.
Mm. Okay, that would be helpful. I would share them also with the group so that it would
Sure.
help them to also understand. And since the screening process is something which they themselves have to do, then I think it would be really very helpful. Yeah,
Actually, yes, the screening process is something that we got to do for ourselves in India.
yeah. So, okay.
Yeah.
Moving on. So, how long does it take for a person to see the results from psychotherapy? I mean, are there factors influencing them? Um, how does the patient get the most out of these sessions? Because I do understand it's just 1 hour that one spends with them. You obviously cannot, you cannot spend more than that too, and it takes some time. So, how long has your experience been?
So, firstly, there are two groups of individuals I see
Uh-huh.
when I broadly work with the general population. There'll be one group that believes that psychotherapy has to work like, say, physiotherapy. You know, 8 sessions and you do something and
But
you get your
answer.
results. Chatpat answer. It has to work like a magic with instant results, and the results have to be downloaded to the person. The thing is that they're coming for therapy, and just like a massage therapist is giving a massage, a physiotherapist is giving them some equipment in which, and that equipment is doing something to them. The belief in this group of individuals is that something will be done to them
Hmm.
in psychotherapy. Some advice will be downloaded, some, I don't know what, hypnosis will be done. So this group believes there will be instant results. And this group gets very disgruntled when they realize that there are no instant results. So the dropouts are highest in this first group, unless, of course, they are amenable to listening to what the therapist says, which is that therapy will take time. But when you come in with these fixated ideas, most of the time people get very disappointed and leave. Now comes the second group. The second group are those who've heard from all different sources that psychotherapy will go on for 10 years, 15 years, 20 years. This group doesn't even come for therapy because they say, Faida kya hai? You're going to come in and the therapist is going to suck money out of you. And once you're in therapy, it's like you've signed up for a lifetime membership to some club or something like that. So there are these two groups of people. And oftentimes, when a new client walks in, I say, okay, group one or group two, where am I right now? I rarely get people who've had some exposure, information about psychotherapy, and are coming in with the right idea of what they are in for.
Correct.
That's like maybe 1% of the people I see. And most of the time, they'll be the youngsters who studied abroad and been in some kind of a care system abroad. So they know how it works.
Hmm.
But most people will be in group one or group two, a higher number in group one. So what I typically will tell people is that first is there's no magic that's going to happen here. There's no instant. I first tell them, look in my clinic, there's no magic wand. I'm not going to take something and, do some jadoo and your problems are going to go. Nor am I going to download any information into you that will suddenly give you a cure for your depression or your bipolar or all these things. The time to see results will vary widely.
Yeah.
And that variance in the time to see results will depend on so many factors. For example, is the person severely disturbed?
Hmm.
In the sense, has intervention just started, a medical intervention just started while the person has been suffering for a very long period of time, in which case, apart from the primary issue or the core disorder that they may have developed so many other comorbid conditions. Now
Correct.
imagine working with that whole set of comorbid conditions. It's not going to be an overnight job.
Correct.
The second thing is people have sometimes lived with long-standing personality disorders or long-standing traumatic stress, but they seek therapy when they have come to the end of the road, literally after a suicide attempt or after a job loss or a marriage breakup or some crisis has happened. In which case, again, picking them up from that place of intense crisis, then taking them to a place of functionality, and then starting to work with the symptoms takes a long period of time. Roughly, the time to see results would vary from a few months to several years, depending upon how long standing the issues have been.
Hmm.
Suffice to say, I don't think the time one is being in therapy is important as much as the um, perception with which you're coming in for therapy. And the perception should be that you're seeing it as an investment rather than the therapist having to do something and do their job properly so that you get better.
Hmm.
And psychotherapy is one place which isn't like physiotherapy or let's say going to a doctor or going for a massage or then going into an EEG or EEG or MRI machine. It's not
Correct.
like a scan. It's not like something is being done to you. It's
Hmm.
not like medication is being given.
Correct.
50% of the work is done by the therapist, 50% by the client. And so if the commitment to the process is not there, the results are not there. It's as simple as that.
Okay. In fact, you also answered part of my next question is on misconceptions about psychotherapy. So something also more would you like to?
Yes, there are.
And I also liked your sentence on investment.
Yes, it's an investment in your health. Many people don't see it that way.
Yeah. Like the annual checkup, I always believe is like an investment. I think I get what you're saying. It's very true.
It's very true because if you're staying with these issues for so long, any emotional issue is sapping your ability to think clearly, to concentrate, to focus. So either you are hanging on to life and not even getting into the job market, or you're hanging on to your job and not able to do anything beyond what you are currently doing. So in other words, you're not uh, without taking therapy for mental health conditions, you're not allowing your brain to develop capacity to do more than it can do
Yes.
currently.
Yeah.
And when you can do more than you are currently able to do, you'll obviously be earning more. It's an investment which will have payback at some point.
True.
So the commitment to the process and also looking at it as not just going in there and sitting is
Yes.
very important.
Yeah.
So that's the first misconception, right? It's the I gave this example to a client the other day. I said, you know what? Psychotherapy is not about you wearing your gym clothes, going there and going to the gym and sitting there and staring at the equipment in the gym.
Mm.
Psychotherapy is about you actually using the equipment. You can't say, I went to the gym but you did nothing there.
Correct.
You just wore your clothes and you stared at the dumbbells and the barbells and the treadmill and came back.
Yeah.
And that you're not getting any psychotherapy done. It's like going to the gym and just going and staring at the equipment. Psychotherapy is actually making yourself vulnerable, sitting in therapy and collaboratively working with a therapist on what you're feeling internally.
Hmm.
It's pretty much a collaborative process. And I again tell this to my clients that I might be an expert in therapy, but you are an expert in your emotions. I cannot read your mind. I do not know what you're going through. I need you to tell me what you're feeling internally so I can help you. So the first misnomer is that therapy is a passive process where the therapist will give all the answers and the answers somehow are going to magically cure this person and get them out of, whatever distress they have. So the American Counseling Association, in fact, says something very important. It says that effective therapy involves active engagement and effort from the client, which therefore makes it an interactive process. Therapy is not something which you're getting a download from the therapist about. It's an interactive process where you need to be able to discuss with the therapist what's going through your mind and be willing to make those changes that are happening based on the discoveries that are going on
Hmm.
in the process. So that's the first thing, that it's a passive process. That's one big misconception. The second, as I already told you, it provides instant results. It
Yeah.
doesn't. It's not Eno. Yeah, it's not going to give you like acidity say jhatpat aaram. Yeah, so in fact, the National Institute of Mental Health says something very interesting. It says that significant improvement can take weeks, months, or even longer. You
Okay.
need to be sometimes prepared for the long haul. You need to be patient and committed. Another thing that I tell a lot of groups that I educate about psychotherapy is that the deciding factor in success or lack of success in psychotherapy is the motivation of the client. A non-motivated client is not going to see success, no matter if they are going to like the most world famous therapist, or they're going to somebody with years of experience and spending a bomb of money. If there is no motivation to change, there is no change. Okay, so it cannot provide instant results. A lot depends on the accountability that the client takes in the process. That's the second misnomer. And the third would be that therapy is only for severe mental illness. Uh, a common thing that I hear from a lot of people is, do I really need therapy? I'm not crazy, or ये पागलों के लिए ही है ना?
Correct.
This is, I mean, in 2024, there are people still telling me this,
Telling us,
and
yeah.
I'm still listening to this. So therapy is for everyone. Anyone can take it. Of course, people with mental health conditions definitely need to, go in for therapy more urgently and maybe in the system, the healthcare system longer. But psychotherapy is for anyone. It can be with somebody dealing with everyday stress and relationship problems right across the spectrum to somebody dealing or grappling with a severe mental health issue.
Hmm.
So these are, I think, the broadest misconceptions around psychotherapy.
But why do you think? So there was one thing which you said is lack of motivation, and
Hmm.
but and we see that especially amongst severe mental illness patients. So if the passivity exists with them, how do this is something we family carers actually face it, and
Hmm.
because of the lack of motivation, they are not ready to go for therapy sessions, and therefore we don't see that kind of improvement also which is required. So how do we help such patients then?
There's a lot of systemic reason for this also,
Hmm.
because the kind of information that floats around on social media or even in generic practice, or people with severe mental illness, when they go for a psychiatrist appointment, the people they see around them, it puts them off the whole concept of seeking help.
Hmm.
They have no option, so they go to the psychiatrist, fill in their prescription, and come back because they know without the medication, they are not going to be able to function.
Correct.
But the whole idea of entering the mental health system for anything more than that might be very off putting for a lot of people, primarily because systemically, we don't make psychotherapy and mental health care a very inviting process.
Hmm.
Um, Particularly if you look at the larger government hospitals, if you're looking at the primary health clinics, you're looking at even the larger mental health centers, there's more sort of a push towards illness than wellness. The
Correct.
whole atmosphere is so off-putting, it is so stigmatizing. Nobody wants to be there. So 80% of people who can afford these types of psychotherapy centers which are low cost are definitely not going to want to get in there because it's unwelcoming.
Mm.
Now, the private practitioners like me, who are like a private doctor or a private surgeon, we can't see so many people, and we are too expensive for the larger population to come to us. But we have the ability to make the therapy space more welcoming,
Correct.
um, and a lot more, let's say, uh, maybe conducive for the person to stay on for longer.
Yeah, the ambience itself makes the difference, actually.
The ambience makes a difference. The fact that there's privacy, there isn't so much shouting and screaming outside. You're not coming into a space where you already feel like there is something wrong with you.
Correct.
But now, Saraswati, in India, we have we don't have a midway between these larger institutions that are managing mental health at a lower cost and these private practitioners like me who are very costly and but have that ability to keep patients on for longer. We need a lot more collaboration between these, and we need for that there has to be systemic change, which means a larger mental health budget. What is our mental health budget? It's a pittance.
Correct.
And जो थोड़ा बहुत था, that also went into COVID after it was taken away into the national health budget. So we need definitely more systemic changes so that therapy is not so off-putting. That is one. Systemically, we need to make a change. But again, at a family level, what can you do to motivate a person to go for therapy is definitely try to do a little legwork and find out, is there a therapist who is affordable, who might not be in these larger systems, but who is compassionate enough to understand this person and what they are going through.
Mm. Okay.
So that might motivate the person to seek help because in the mental health system, a person suffering from schizophrenia or bipolar, OCD has been told so often there's something wrong with them, they don't want to hear it one more time.
Correct.
And they don't want to sit for an hour with a person who's going to drill that into their head. That's their thought process.
Yeah.
Whereas if they understand that the help they're getting will actually make them better,
Mm.
it's not going to stigmatize them but make them better, that might be the trick to getting them into therapy.
Okay. Okay.
So education, compassion, taking them to the therapy appointments, sitting with them, working alongside the therapist, trying to also do other forms of intervention like support groups.
Mm.
Those show a more long-term benefit
For
for
them.
people, yeah, for people who are reluctant to seek help.
Okay. So also, I would think even family therapy in this would actually make a lot of difference. Which
Has to make a lot of difference. But again, there is a lot of cost associated with it. So people are often reluctant to take all these various forms of intervention because everything comes at a cost. Plus, in our country, we don't have, like abroad, we don't have insurance. So at
yes,
least some of it is borne by the government. That doesn't happen, or by an insurance company.
yeah,
It doesn't happen in India. So it's a difficult question. How do you bring motivation about without making systemic changes?
yeah, and also I think the family carers. I mean, I have at least seen that is uh, he only has to go for therapy. It's
Correct.
not like there's a denial with the family also saying that let's get together, get into therapy together, and then make that environment conducive even at home. So I think that's
Absolutely correct. That's another place that if you can educate family carers, that even just going for the therapy appointment with the person can make a dramatic difference. Not going and sitting maybe in the therapy room, but even waiting for them in the waiting room.
yeah, yeah.
And just being there for them can make a very big difference.
You spoke about stigma,
Hmm.
and I
Hmm.
mean, I at least see the younger generation, the Gen Z now, talking about going to therapy of, far more easier than what it was in the past. But still, with the misconceptions and, the stigma around. How do you think we can break this?
Um, Again, at a very systemic level, we need to, because help-seeking hesitancy is
Mhm.
extremely strong even now. In the research articles I've read as recent as 2022 and 23, we still have a large proportion of people in India who would prefer to visit a guru or a baba or a fakir
Mm,
or Ayurvedic doctor than a psychiatrist or a psychologist. So there is some kind of a safety in these traditional forms of healing, not that they are wrong, but they may not be very suitable for certain types of mental health conditions or probably the whole range of mental health conditions. So there is a lot of stigma. That stigma is also not wrong because there is malpractice, a lot of malpractice that is floating around. So the responsibility is both on the mental health professionals, on society as a whole, to to reduce that stigma.
mm,
I always educate mental health professionals that don't take on a client unless you really feel ready to take them on and work with them. And you have adequate supervision and you are able to work with that client. Similarly, there is a lot of stigma that happens because there are still mental health professionals um, who are homophobic, for example, and believe that they can they believe in conversion therapy. They're going to change a person from being gay to being normal, so to speak. So we have so many of those people practicing proper psychiatrists practicing conversion therapy in
strange.
India. Yeah. So imagine the distrust. Then there are a lot of psychiatrists who are unwilling to adopt newer methods of medication, which work faster. They keep on giving the same old medication to the person, and there is no change. Now, there are medications are evolving. We have some really great new medications that are introduced in the market. Many psychiatrists are unwilling to make those changes. So
Okay.
that is why a lot of people get stuck in this health system and believe that इससे निकल ही नहीं सकते हैं. That increases the stigma. And then what happens is that they tell their family members, I was stuck with medication. Tell nobody in the family to take medication.
Mm,
So what happens is a lot of people come to me saying that we'll just take one session of therapy because we want to see what you do, but don't tell us to don't even use that word medication because I saw my uncle ka, chacha ka, mama ka, some pua ka, somebody fell
mm,
in, had depression and 20 years they took medication and then the medication made them even worse.
okay.
I must be hearing this, I don't know how many times. So
Okay.
this is primarily also creating the stigma perpetuated by the mental health system itself, which is not updating themselves, which is also doing malpractice. So, one definite change has to happen in a better breed of mental health professionals who are trained correctly, who are updating their knowledge correctly. So, that's one way to reduce the stigma. And of course, the second way to reduce the stigma is to somehow educate the general population that these traditional forms of healing, while they are very good, you don't have to discard them completely. Go to your Baba, Fakir, go to anybody, but along with that, go to a mental health professional. You don't have to choose between both these. So, educating people
Yes.
about these, yeah, you can use both together. And of course, um, avoiding using words in the general public like pagal, yeah, satkela. All
Mm,
of these things are very, very stigmatizing. So general language also has to change. We need to normalize mental health treatment. We need to see it as something that's important to take, just like we go to a doctor. Okay. For a long time, no treatment for breast cancer was developed.
mm.
And you know why no treatment for breast cancer was developed? Because we were too shy to even talk about breast. Mental health is like that.
Like that.
We're
Yeah.
too shy. We are too, how do you say? We
We're
want to
very
stay
apprehensive.
away.
Yeah, we're very apprehensive that people are judgmental and,
And these are big words. Nobody wants to use them. So even when I'm talking to a corporate crowd, okay, now corporates, because of the stress, see a lot of suicidal people.
Correct.
within their organizations. But if I tell, let's say, an HR of an organization, can I do a talk on suicide prevention or on self-harm? Oh, no, 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 those words, don't use those words. Yeah. So it's like nobody wants to see. These are taboo words. But why? A breast is not a taboo word.
Yeah.
You didn't develop breast cancer treatment because you didn't want to see that a breast existed. So
Correct.
you don't want to have interventions for suicide because you don't want to think about it. You don't want to use that word. So to my mind, unless we start changing that outlook, which to me is an extremely narrow-minded outlook, and we need to change this in tier one and tier two cities. I'm not talking about villages. I'm
Yeah.
talking about organizations that are in tier one
Yeah.
and tier two cities that are still not willing to think about suicide and self-harm as common things that happen in our daily lives.
Hmm.
So definitely we need to change our outlook.
Another thing which when you were speaking about the qualifications, so
Hmm.
how do families then actually choose, who's a qualified therapist that I should be going in? Since we have to do the work, how do we then identify that?
Yeah, so a good idea was given to me by a client himself.
Okay.
Okay, what he is now, I'm changing the story around, so I want to hide this person's background. But how he chose a therapist was he went into he would take an appointment. He'd pay the therapist, but he'd also go into the office and see, can I see the certificate anywhere on the board
Okay.
or anywhere displayed outside? The first thing he'd ask the therapist as soon as he sat and tell me your qualifications. Most of the time he was chucked out, told to leave. But he paid the money, but he found a therapist only after asking them their qualification.
Okay.
So if a therapist gets prickly,
Hmm.
they get cagey, they give you as a goal answers. They are not giving you a straightforward answer about their qualification. Just say salute, leave.
Okay.
An ethical therapist should have their degree displayed right up there in their clinic waiting room. Of
Correct.
course, if they're working in a polyclinic or they're working alongside other doctors where that's not possible, maybe. But it is every patient's right to ask their practitioner, please tell me your professional background.
Okay.
And it is the ethical duty of your practitioner to either guide you to a website or to any place that will give you the qualifications of that practitioner.
Okay.
So the qualification you're going to look for is a master's degree, an MA or an MSc in clinical or counseling or applied psychology.
Okay. Okay.
This is the basic that is required by the UGC, University Grants Commission, to qualify a person to enter the mental health field.
Correct.
Beyond that, the person should be having at least an MPhil in order to be working with a hospital and providing disability certification. But the
Correct.
minimum is a master's degree.
Okay.
If you don't have that and you have like a 6-month degree from some dubious counseling association somewhere, no, that's not a therapist you
Not
should be going to.
everyone should be going through. Okay. Yeah.
Okay.
And I think that's a lovely message to our families, how they should go about it.
Yes.
Yeah.
Ideally, an ethical therapist, if they are working in a private practice or they're working in a clinic setup, will have their degree displayed right outside.
Absolutely. Yeah. There's nothing to
The
hide.
idea, there's nothing to hide there.
Exactly.
Absolutely. They will have their latest certificates. They will have wherever they have taken their most important certifications, everything visible and everything overboard. So most of the time, no one even asks me my qualifications. They don't need to because I already send them links with everything, all
Yeah.
the details that they need to know.
Yeah.
So they know they're coming to somebody with the right kind of educational background.
That makes a lot of sense. Yeah. I'll ask now Dr. Sachin to take over and ask the next lot of questions. Over to you.
Yeah.
Sir.
Thank you, Saraswati. Thank you, ma'am. It was a wonderful session. I was just reflecting and just trying to encapsulate what you had said, that basically professional counselors and therapists are there to help us during our vulnerable times. And as Saraswati was mentioning, that we use psychotherapy, counselors, CBT interchangeably quite often, and it's very confusing. So therapy has become a generic term. But I think therapy is a great investment, and I think that is how it should be looked into. And it's a very valuable way that I think what you mentioned is, I think, the the psychotherapy field needs to be regulated. You need to find out credentials of people actually whom you visit. And Saraswati also mentioned about stigma, which is also very important. And how I think that was a good message from your side, that you can go to your informal practitioner, but you can also seek good mental health advice. So I would just continue from here. Uh, how has the field of psychotherapy evolved in the recent years, particularly with the advent of online therapy? What is better, online or offline, in your opinion?
So, Dr. Sachin, when I began, I have been working almost 25 years now. So, I always, using the traditional approach, if somebody told me pre-COVID times take online clients, I would have said no, never. No, because I came from a completely in person. I was 6 days a week in clinic, no online sessions. And the only time I saw a client online prior to COVID, I'm talking about, was if they were transitioning from my therapy practice to somebody abroad. Then just that time before they found another practitioner abroad is when I saw them online.
Mm.
I didn't see people online. My entire paradigm has shifted 180 degrees since COVID. Because all my practice moved online, right? Literally within a week of the lockdown happening, everything moved online. So from 6 days a week, 6 clients a day, to completely moving online, I had to make many changes in the way I operated. And I had to upgrade my knowledge. I had to upgrade the way I worked with somebody who was not in the same room as me. And I work with complex trauma and dissociation, where the person, is unable to even stay in the present for as much as 5 minutes sometimes. So I had to transition to that mode. And I initially said, I can't do um, trauma work online. I don't think that online is the medium to do it. However, I saw a lot of evolution happening in the field of trauma care, in the field of somatic psychotherapy, and in the field of traditional practices like CBT, where a lot of modalities shifted online and started, acclimatizing to the online environment. So I won't say that online is not good or it is not a valid form of intervention now. We know teletherapy does work. I have had the courage after about a year and a half of working online. I also started doing actual work with trauma memories. I didn't have the courage to do it in online session. Now I'm fairly comfortable after 4 years of working in this mode. So it has many advantages. For example, because of online therapy, I'm seeing somebody in a tier 4 city who would never in their lives be able to take up therapy sessions with me. So I have few pro bono slots in a week, which I give out to people who are low income or no income. And I would normally have to do that, of course, with people in the same city as me. Now I can offer those slots to somebody who will have no access to a practitioner sitting in a remote location somewhere. So definitely online therapy has advantages. Another way I see an advantage happening is our students who are stuck abroad in mental health systems. Take the NHS, for example. A student going, you know, from here, let's say to the UK to study, has to apply to get into the mental health system through the NHS for 6 months, 8 months, and they're still stuck with no practitioner. So for that person at one point of time, taking therapy they would have given up. But now they don't need to do that. They can work with an Indian practitioner. And since we don't have any state laws or anything governing those things currently, we may have it soon. So this is another advantage that people abroad can seek therapy because they're not able to either afford the practitioners there, they don't sometimes adjust to them, or they don't get practitioners only. So there are many, many things that are accessible because of online therapy. But if you ask me again, now that I'm doing hybrid, working in person as well as online, there are some advantages to in person also. When you sit in the same room as the person with certain types of presentations, certain types of client presentations, you get better results when you are in the same space as the person. So I won't say either of these can be discarded. Both will have to work in conjunction. And I see that the evolution of the mental health field will go into a hybrid mode definitely as we move along. That's where I'm seeing myself go as well, because I don't see online completely disappearing, since I also want to offer care to people who can't get care. At the same time, I will never give up my clinic practice. That's something which is very, very important for certain sections. So I feel that the evolution of psychotherapy has been far and more massive since the lockdown. So it's good going for the field.
And also travel times have become so much between in the city,
Yeah,
So
yeah.
I think it also helps, especially if you have to take our loved ones, to a therapist, which is a little far. I think it,
Also, absolutely. Also, what happens is, let's say the rains occur and a client can't come in. Or there are times when, because of medications, client can't get up in time to even make it for a session. So I offer them those alternatives that look, if you can't get up in time and come in, take that session online. When you can come to the clinic, try and make it. So that kind of flexibility I do offer. Um, and I feel that's what every practitioner should also start getting into, offering this flexibility as much as possible.
Oh, thank you, doctor. I think that was quite nice. And as Saraswati earlier mentioned, that sometimes a person might not be aware that they have a mental health disorder. There might be
Hmm.
social stigma. Also, sometimes you don't know whether the person has insight. So I'm just saying, if you have a person, whether he has a
Hmm.
mental disorder, and sometimes you, you would just want to avoid a social interaction. So I think maybe technology can be a way in which you start connecting with the person first time. The question which is also a follow-up to the first question about online is, how do you see the future of psychotherapy? Are there any emerging trends or new approaches that you find promising, especially with the influence of technology? And nowadays we hear about AI and also Telemanis, which has been launched by the government of India.
So all this is looking very promising. The integration of technology, the AI-driven mental health apps, virtual reality therapy, all this is looking extreme. They're all gaining traction and they're not going to go away. They're only going to become more advanced, just like AI is going to become more advanced as we go. Um, the fact that uh, how I would see it, right? I would just see it that a person is not going to ever want to talk to an app. That's never going to happen. No human will ever be okay with that. That's not how our brains work. But these technologies are going to be extremely important for between session and also to get the person to probably work through a crisis, to help them to overcome an immediate issue, for example, to help them to record thoughts, to be able to maybe streamline their emotions. But at the same time, in-person sessions or working with a practitioner, that's never going to go away. The issue is, or that's never going to become outdated in the sense people say, oh, AI will take over. AI is not going to take over any human being work unless, of course, it's very I would say, what should you say, clerical kind of work, which can be driven through AI. However, I do believe that therapists who don't get trained in AI or refuse to embrace AI, they may find themselves outdated soon. So it is very important to keep updated, to constantly understand what's coming in the market, to get familiar with the new apps, and to be curious about what your clients are using, ask them what has been helpful, and for therapists, for psychologists to use those apps themselves so that they see how it works and they don't completely discard technology. Because those who are afraid of technology, whether it's a teacher, whether it's an engineer, lawyer, therapist, anybody, the ones who are afraid of technology may find that they're left behind somewhere. So to get educated, to get updated, that's what's important because this is not going anywhere. Let's be honest about it.
Thank you, doctor.
Yeah.
That was a very good combination, like that people have to keep themselves moving ahead with what is
Mm.
happening with AI and after the pandemic. Also, we had one question. How does one help a person in a case of an acute emergency like a suicidal ideation? Whether one should seek medical help or psychotherapy, or one should contact a suicide helpline?
So when it comes to acute emergencies like say suicidal ideation, you need an immediate intervention. And at that point of time, definitely psychotherapy can't be the first line of action. It plays a vital role in long-term therapy, but it is not a crisis intervention. Ideally, when there is a crisis, you either contact your primary health physician, take medical help, contact a suicide helpline. You also might want to visit the emergency room of a hospital and have somebody give you immediate intervention. There'll be, of course, doctors on call. They can also call in a psychiatrist if needed. But you cannot be asking a psychotherapist for an like a crisis appointment. What is the therapist going to do? They can't offer any immediate intervention. Psychotherapy is more long term. So, however, psychotherapy and psychiatric intervention has to be part of a comprehensive treatment plan, because after the person comes out of that emergency, they are going to need to have some kind of stable form of care so that they don't again go back into an emergency. That's where the role of medication and therapy comes in.
Thank you, doctor. Thanks a lot.
Yeah,
The question is, should psychotherapists become a regular feature in our health setups, like how you mentioned about health check, wellness checks,
yeah.
or is it only a service for people or families who live with mental illness? Also, just wanted to add, as you mentioned earlier when Saraswati was discussing that, should it be in formal settings, or do you want, like, if when you watch movies like Dear Zindagi, it's in an informal setting, and also should psychotherapists be your friends? So these are quite common questions which actually come up uh, when we want mental health to be more integrated with the physical health setup in our current times.
Yes. So psychotherapy should definitely be in a formal setting. Now, let me answer this in two ways. One is, should psychotherapy be integrated and be a regular feature in health setups? That would be the dream that this country has to look forward to. We would want that a proper certified, trained mental health professional is part of every organization, part of every healthcare setup, primary, secondary, tertiary healthcare setup. And because, of course, it's an integral part of our well-being. And psychotherapists are not just working in NGOs or working in psychiatry departments of hospitals, but they become a regular feature everywhere related to mental health, because access to psychotherapy can benefit everyone. Now, the second part of your question, which is, should psychotherapy be more formal or informal? I always feel that for any health intervention, even for a doctor, it is important to have a formal setup. I was speaking to a primary care physician some time ago, and he was telling me, Havobi, there are a lot of people who call me up on the phone and say that they have something, whether it's a headache or something happening in their stomach, and they ask me to give an intervention immediately on the phone. And I always tell them that that's not the kind of place I have to give you an intervention, because that I need to examine you. I need you to sit in front of me. I need to have some way in which I take your history. This is what I heard from a primary care physician. For a therapist, that is even more important, right? We can't be sitting on a boat with a client like they showed in Dear Zindagi and having an informal session. It doesn't work that way. There has to be a safety and security, a formal setting in which the person feels secure enough to talk about their issues and problems. The therapist has to be in a mental space to be able to listen without distractions and to be able to process what the person is saying. So I'm not so sure therapy, or for that matter, any healthcare intervention, can happen without a proper setup. That aside, of course, we have certain crises, like you have a tsunami happen or a bomb blast happen, or you have an earthquake happen, and you have these disaster sites in which people are working anywhere and everywhere. But those are only temporary solutions. That's not how daily life looks. But in daily life, in order for effective therapy to happen, we need, or for any effective health intervention to happen, a proper setup is essential. That would be my answer.
Oh, thank you, doctor. And also, if is it only a service for people or families who live with mental illness, or as you rightly said, it's an investment, but it's so difficult to actually convince people to participate in it. So what would be your advice to people? Like how you mentioned about corporates, and it's a taboo word to use self-harm or suicidal ideation. How would you see? What would be your advice to people in general?
So my advice to people in general would be that read up about mental health and try to make small changes in just the way in which you're communicating to each other. Like I said, avoid the use of the word pagal, or don't call somebody who's just organized as OCD, for example, or somebody who's just feeling low, oh, you're so depressed. So stay away from these stigmatizing words or language so we can bring that change about. Gen Z is trying to do that in their own way, whatever way that is. But even the older generations need to be able to be more sensitive in the way that they are talking about mental health, the way they're talking about women's issues, the way they are talking about relationships. So we need to have a little more sensitivity in our language. I think that's the first place that stigma can start breaking. That if in our social conversations, daily conversations, we don't take these things so lightly, we bring in a little more sensitivity in our communication. That might be the starting point for motivation and for changing the way we look at mental health.
Thank you, doctor. Thanks a lot. And as Saraswati earlier mentioned, and you were also mentioning about the health system where our budgets are low, uh, there's hardly any budget for mental health.
Mm.
So personally, as you rightly mentioned, when Saraswati started, that caregivers are struggling. They are dealing with their own emotions. They have somebody there's a loved one at home. Then you are also grappling with the system which is around you. It might be your workplace, or it might be your government system, or you are trying to access any government help. So all of us are our basic audience are family caregivers. We are families and we are caregivers. So as a psychotherapist, what would be your advice to me, Saraswati, and all of us who are actually listening to this podcast?
I hope that we have a future in which people can access mental health services and not be so fearful of the expenses associated with it, that there is enough of priority given to mental health in the budget, in the budgetary allocations at home as well, in organizations, everywhere. Yeah, it's not, mental health is not like a last priority, but one of the first priorities that can be there. So I'm hoping that we see this in our country in the future. But my advice to your generic group of family carers, and any carer, whether you are managing health or a mental health condition or a combination of both, is prioritize your own self-care. There are a number of caregivers who come to me who are burnt out and have issues ranging from irritable bowel syndrome to hyperarousal, constant anxiety, insomnia issues, generalized anxiety disorder. So taking care of somebody does create a strain on our nervous system. And so you need to educate yourself about the condition. You cannot become a sponge and absorb all of the emotional, struggles that the person with the condition is going through. You need to take breaks without feeling guilty. You need to approach a professional for your own help when you need to. And you also need to recognize that in this country, there might not be that much of sensitivity to a caregiver. There is only some amount of sensitivity coming in for mental health and health issues in our country, but caregivers are nowhere on the horizon at this point, at least. So even though you may not get social support, try to create a small group of people around you who can be supportive without being judgmental. You might not have a large number of people, one or two is also enough, but at least they have your back. So that's another advice that I'd give to your group. And I hope that people listening on this podcast also get an idea about the right kind of help that they need to seek from professionals.
Thank you, ma'am. I think that's very nice. And I also just wanted to ask you, there is a lot of venting out which happens because of certain deficiencies in our system, and people are not able to get a handle of medications or proper doctors, or they struggle looking after their loved ones. So what would be your one message which can deal with them with this better? You've already captured that they should do self-care, but what is one more message you would like to say, that this is what you should be basically focus upon?
I think it's important to recognize that in the end, what really stays, what helps a person stay on in a difficult relationship when they're looking after someone else is a bond. The reason they're staying on is because of an emotional bond. So
Correct.
on really deep, dark days or our days of struggle, it's that small little ray of sunshine that says, I had that moment of connection with this person, or I hope that that glimmer of that person can come back, is what helps a person stay on in that relationship and hope for better days. So that shouldn't ever die out, because over and above everything else is really human bond. And nothing should supersede that. We are all together. We continue to live with difficult families because, or with difficult systems around us because of that bond. So, right at the end, when it all boils down, it will boil down to your feeling of attachment that you have with that individual. So, keep that in mind. That will keep you going through really dark days.
Oh, lovely
Thank you,
message.
ma'am. I think that was very well summed
Yeah.
up. And so just wanted to thank you. I'll also hand it over to Saraswati to say the final words. But I think throughout the whole podcast, we have got a very good glimpse of what is actually therapy about. And it's an investment. Uh, it is not a reactive measure. And also, I think one needs to be patient and accountable. We cannot just go and get a download and say that it's not a quick fix or a 2-minute Maggie noodle that I would eat it and it will change my life. So I think this is a lesson what I have gained, and also I've understood that it has to be done in a formal setting. Also, it has to be interspersed during a follow with online tech and AI, which can actually reduce redundancy and clerical work. So thank you
Absolutely.
very much for your inputs, and I'll hand it over to Saraswati for the closing remarks. Thank you for your time, Doctor.
Thank you. Thank you, Sachin.
Thank you so much, Hvovi. It's always a pleasure talking to you. And thank you so much. I appreciate for you being our guest this time. Thank you.
I appreciate you having me on this platform to speak about such an important topic. In fact, your podcast can be like a one-stop shop for all those various things people ask about psychotherapy, because all the questions that we've covered are the range of questions that I'm sure mental health professionals are asked on a daily basis. So it's like a one-stop shop. I'm happy that we could have this podcast, put it together, and I hope a lot of people listen to it. And I wish you and your organization all the best.
Thank you so much.
Thank
Thank
you.
you.
Thank you.
Thank
Thank
you.
you. Thank you.